All right, everyone, here to talk about home health physical therapy, home care for people that cannot leave the house. Physical therapist, it's a pretty good job. Now, what you think about physical therapy in general, you might not think of home health as an option. Now, we as a company, we do a couple different areas of physical therapy. Now, outpatient, inpatient, skilled nurse facility, acute care, home health, assisted living, and private practice. But home health is an area that some people it gets a bad rap. Now, it definitely is a good aspect to do part-time, full-time, PRN. You can do as much as you can because you get paid per patient by most companies. Now, most companies will pay you a good amount of money to do an eval and a little less for treatments, or some companies do both. Eval and treat is the same amount of money. Some companies pay mileage, some don't, because again, you're using your car. Most people are going to leave from your house, drive to wherever, drive 30, 40, maybe 50 miles a day, depending on where you have to go, come back, do your documentation. Now, it's going to be computerized documentation for the most part. If not, you have paper. Sometimes paper is a little easier to do than computers if they're not working or working. Now, I go and it's computerized documentation for the home health agency I work for, but you can't connect sometimes to the server through the internet. So I just brought it, I leave it at home, and I bring a notebook and pad and paper to write down the notes and then transfer it later on. And that's the thing where you want to do your notes. Now people are like, oh, it's a lot of paperwork, it's a lot of documentation. It's okay, it's not bad. I mean, it's not that much more than outpatient in some aspects. It's less than outpatient during an eval and everything there too if you document well during your note-taking. You want to do vitals, check their blood pressure, pulse, respiratory rate, pulse ox. You have one. If you're going to get into it, definitely get a pulse ox because it'll give you a pulse and the O2 saturation, which is great. And they're not too bad. They're like 30, 40 bucks to have for a long time. Then you go check them out, do some manual muscle testing, some lower extremity strengthening, maybe some occupational stuff. If you're doing OT as well in there, they might do some upper extremity stuff, throw it in there. But most of the part, you're doing gait, home exercise education, gait training, educating the person on what to do, working on their endurance, because these people are deconditioned and fatigued from being in the hospital for an extended period of time. And they come in for home health. Most of the time they get 5, 6, if you're lucky, maybe 8 visits. Then they get discharged to a home program or to another facility. Now, if they can't leave the house, you have to be, that's why you have home health, because they can't drive or they live alone, they don't have a caregiver, they don't have an aide, they don't have anything. So you're there to make sure they can get around ambulatory in their house with proper gait, safety, make sure their living conditions are pretty good for homebound gait transfers and activities of daily living. Now, sometimes you have to deal with dementia in these elderly patients, or every patient we have had so far is a dog. They have had dogs. They want to nip at you, they can bite you and worry about this, and the environments sometimes aren't the cleanest, so you're at the mercy of their environment, so that can be a little disheartening. So you have to be careful of that. Gloves, mask, universal precautions, of course, in general, without washing your hands, keeping germ-free, alcohol, sanitizer in the car to help you cut down if you can't wash your hands at the person's house or anything. But, so home health, good job, part-time, full-time. I have friends that do it. We have colleagues that do it and make a ton of money. Now, I do it part-time. Some people I know do it full-time. Part-time is not bad. I pay you a little bit more of that, but I would like to get a little more patients that I'm getting, so I do a little outpatient on the side as well right now. But ultimately, sometimes home health could be an agency that you want to work for down the road. You're going to get paid anywhere between maybe $60 to $75 an eval gross. Now, after taxes, it's going to be a little less. With net, it'd be a little less than that, but I mean, making, $55 to $60 a patient, that's pretty good. Driving around, you got to cut costs with your gas and maybe you don't get paid mileage, so there's going to be pros and cons of each. Documentation is good. You come home, you do it in the comfort of your own home. You don't have to sit in the clinic and wait there to drive home for 30 minutes or an hour. You can do it on the way home, get the notes done the same day, maybe the next morning on there as well. So eval usually in between 60 to 75 bucks per patient. and maybe treatment is a little between 55 and 65 between that. Different agencies pay a different amount. So that's just a range. Don't quote me on that. That's just an idea for wages, hourly. Salary might be different. I don't know if some agencies might do salary. So look into that, part-time, full-time, PRN as needed. If you want to look into those things, it's pretty good. It gets a bad rap, but it's fun. You're changing these people's lives too, and the element that is good for them as well. So look into that. It's definitely a good aspect to do. Maybe mix it up. If your whole career was outpatient, try to work on that a little bit. Part-time, maybe it's nice to mix it up a little bit. Sometimes you get in a rut with your job and everything, and therapy is great because you can do that. So again, if you like the video, like, subscribe, share, tell people about the video, post comments, questions on there too. If you have any questions, let me know. We'll check it all the time. Like that again. So the home health agency, good option for you. Check it out. Physical therapy in general is a good career. Other future videos will talk about that as a job and everything. But again, if you can, guys, like, subscribe, share, all that good stuff. And thanks.